In the United States, the government only authorizes surgery, radiation, and FDA approved chemotherapy drugs for the treatment of cancer. Those providing alternative treatments risk fines, imprisonment, persistent investigation, and or loss of license if they prescribe or utilize anything outside of these approved protocols. Not only does this totalitarian structure block progress in the war against cancer, it effectively keeps those who are making progress from publishing their findings in peer-reviewed journals. Even so, some are courageous enough to step forward. Here are, here are recaps of three such cases where vitamin C therapy was used. Renal cell carcinoma. The right kidney of a 70-year-old male was removed after it was found to be cancerous. During the surgery, doctors discovered that the patient's cancer had spread to the liver and lung. Neither radiation nor chemotherapy was used. Instead, intravenous vitamin C treatment was started at 30 grams twice a week. After 6 weeks of therapy, the patient stated that he felt good, and an exam confirmed that his cancer lesions were shrinking. 15 months after starting therapy, there were no signs of progressive cancer. He remained cancer-free for 14 years until he finally died of congestive heart failure. Non-Hodgkin's lymphoma. A lymphatic tumor around the spine of a 66-year-old female was treated with localized radiation therapy 5 days per week for 5 weeks. Simultaneously, she was started on intravenous vitamin C twice per week. After the radiation therapy, chemotherapy was recommended, which the patient refused. The vitamin C therapy was continued, however, and she also added several oral supplements after lab tests indicated specific deficiencies. About 5 months after the start of treatment, the patient reported pain and swelling of the lymph nodes at the base of her neck, just above the collarbone. One of the nodes was surgically removed. A pathology report indicated the presence of malignant lymphoma cells. Her oncologist recommended more radiation and chemotherapy, which she refused. Instead, the intravenous vitamin C and oral supplementation were continued for another 19 months. The cancer finally disappeared, and 8 years later, when the study was published, the patient was still cancer-free. Colon cancer. A 51-year-old man developed bright red rectal bleeding. Examination found a malignancy in the colon. Surgeons discovered that his tumor had penetrated through the bowel and into surrounding fatty tissue. They also found that the cancer had spread to his liver. Following surgery, chemotherapy was started. The patient and his wife asked the oncologist about vitamin C therapy. He assured them that vitamin C would be of no value. Subsequent examination and surgery determined that his cancer had continued to spread and had moved to his stomach. Although he was told his prospects for survival were slim, another round of chemotherapy was prescribed. Again, the patient asked about vitamin C therapy. The oncologist responded, "I know of no studies which show that this vitamin C therapy would eradicate or delay progression of cancer." Despite the two recommendations against it, the patient found an independent clinic to administer intravenous vitamin C at 100 grams twice per week while he continued the prescribed chemotherapy. A little later, oral supplementation of vitamins and minerals was added to the regimen of vitamin C. After about 5 months, the patient went on a 2-week vacation. During this time, he continued chemotherapy but discounted the intravenous vitamin C. Almost immediately, he began to experience, for the first time, the typical chemotherapy side effects of nausea, diarrhea, stomach pain, and inflammation of the mucous membranes of the mouth and throat. Upon returning from vacation, vitamin C therapy was resumed. The side effects stopped immediately. A CAT scan over a year later showed no evidence of cancer. In an interview afterwards, he described himself as perfectly healthy. Undoubtedly, many will assert that the 3 preceding case studies are only anecdotal and that it does not prove that vitamin C is effective in treating cancer. The tobacco industry used the same kind of self-serving logic for decades. The much higher incidence of lung cancer among those who smoke doesn't prove that smoking causes cancer. From a philosophical position, it may be true that case studies don't provide the same quality of proof as a large, randomized, double-blind, placebo-controlled study. But from a practical position, these people, and many others, were very sick and now are well. Coincidence? I don't think so. More evidence. At the Oasis of Hope, a cancer treatment hospital outside the U.S., a new high-dose intravenous vitamin C protocol without chemotherapy is being employed. They've been using it for just over 2 years. And this book was published in 2012. They've been using it for just over 2 years. Even so, their published 2-year survival rate for stage 4 cancers are impressively better than those achieved with conventional therapies. Breast cancer, 75% more survivors. Lung cancer, 887% more survivors. Colorectal cancer, 107% more survivors. To be complete, it should be noted that treatment at the Oasis of Hope includes several aspects not associated with conventional therapies in the U.S. These include lifestyle changes, including exercise and a diet rich in raw organic foods, reducing toxic exposure, and avoidance of refined sugars, improving vitamin C uptake, and eliminating cancer's favorite food. Emotional and spiritual counseling. The Oasis of Hope, which also offers conventional therapies, says this about their alternative vitamin C therapy, IRTC. The very good news about the IRTC approach is that it does not harm normal healthy tissues, which have adequate antioxidant defenses. Thus, IRTC is virtually free of side effects. Every month, thousands of hospital patients die from reactions to drugs that have been prescribed and properly administered according to the FDA-approved protocols. Not a single FDA-approved cancer drug has ever come remotely close to being free of hazardous side effects. A very unacceptable percentage of people treated with FDA-approved cancer drugs still die from cancer, and yet a physician in the U.S. who gets caught using non-FDA-approved protocols on cancer patients can go to prison, and it doesn't matter how often or how many of the cancers disappear. Specific anti-metastatic mechanisms of vitamin C. Vitamin C inhibits both tumor growth and cancer spread. In the same way, an optimum level of vitamin C in the coronary arteries keeps the cellular glue, ground substance, in blood vessels firm and healthy. It is also responsible for the formation of a strong, supportive extracellular matrix in other tissues throughout the body. A deficiency of vitamin C allows the ground substance or matrix to become weak and watery. When this deficient state becomes continuous, tumor growth can be both initiated and facilitated because the external support grid that would normally restrain cellular proliferation can no longer do so. When ground substance loses its firm gelatinous consistency and becomes watery, the doors open for malignant cells to break through lymphatic and blood vessel walls and migrate to other areas of the body. High-dose vitamin C keeps ground substance strong and provides optimum anti-cancer protection for healthy cells, including those directly adjacent to an already existing tumor or lesion.